Warm welcome to this talk. It's Tuesday the 25th of October. Now, I want to look at a few things today. The main one probably is going to be the excess deaths in young people in the United States. The official data is showing a cumulative total of around about 17,000 excess deaths in 0 years to 24-year-olds in the United States. So I want to look at that in a minute. But before we do that, I want to start off with some good news if you're a shareholder in Pfizer. Pfizer expects to hike US COVID vaccine price to $110 to $130. Now, that's correct, $110 to $130 per dose. This is just quite incredible. And yet this is what is reported by the Reuters news agency. One of the chief executives, Pfizer expects to roughly quadruple vaccine price. That's times 4, isn't it? $110 to $130 per dose after the United States government current purchase scheme expires, currently paying around $30 per dose to Pfizer and German BioNTech. And Pfizer expects to market roughly about the same number of COVID shots as flu shots by the looks of it. So this is just quite, I was quite taken aback. You know, okay, inflation could be 5 or 10%, but given that their profits were already higher than yours and mine perhaps, to increase the price to $110 to $130 per shot is really quite staggering in my view. But what do I know about business? Now, distressing news yesterday. Mr. Tim Gough, and we just extend our deepest sympathies, condolences to Tim and his family. Tim Gough just died when he was presenting his radio show, believed to be heart attack. What probably happens here is for some reason the heart muscle just starts fluttering and it goes into what we call ventricular fibrillation. So sad to see that that has happened. I suppose the slight consolation is he was doing what he loved doing, but nevertheless a tragic death at the age of 55. And that got me thinking about excess deaths in the young. Okay, 55 is middle-aged, but there is an excess deaths at pretty well all ages at the moment. Now, we've looked at some UK data. Just want to look at some UK data briefly here. Now, this is by age group, and again, this is the 0 to 24 age group. Now, why the government are using 0 to 24 years? I mean, that's a pretty big chunk of age ranges. I would have much preferred to see this broken down into, well, ideally, but by the year, or certainly by the 5-year blocks. But why they're doing that so crudely? We would like to see much more finesse in the data, but anyway, so we've seen that excess deaths have been lower. So this is July 2021 here, and we see that basically the excess deaths are these on the top line. So we're seeing kind of more excess deaths here than we are reductions beneath here. So this is a trend towards increased excess deaths in the 0 to 24-year-old age group in the UK. Now, this line here, that line there is 20 per week, excess deaths per week. So we can see that some deaths, some weeks there's 5, 20 or even 30 excess deaths per week in this age group. Now, some of these could be COVID related, others will not be COVID related. I suspect the majority are not directly COVID infection related. And we really need a massive national inquiry into this. We need to know what's going on here. We've flagged this up many times on this channel. Mainstream media just not seem to be picking this up. But I find it personally quite alarming. And I've just blown up that bit there on the end. I've just blown that up so we can kind of see what's been happening. Now, to be fair, this wasn't updated since July, so it's a bit out of date. But we can see there's quite a lot of excess deaths here above the line, and weeks with lower excess deaths than we would expect below the line. And of course, if we average these out, we find that there's much more excess deaths than we would expect in the 0 to 24-year-old age range. And I just renew my requests. We really need a huge research project to find out what's going on here, and the lack of interest in this in mainstream media, and by the academic and scientific and government community just astounds me. Yet the data is here. Now, in the United States, I'm going to show you some US data here as well, because there has been a lot of excess deaths in the US. But this is the graphics here for excess deaths in all ages in the States. Now, what we're looking at here is these crosses here represent weeks when there was statistically higher deaths than we would expect. This line here is the average we would expect in terms of deaths for the time of year. This line above it here is when deaths are statistically higher than we would expect. So we see that all these weeks where there's crosses here, the deaths are higher than we would expect for the time of year. And that data does go up to the 1st of September. And we can see that there in colour as well. So we are seeing excess deaths in the States. Now, quite a few of these are COVID related, of course. The excess deaths in young people are much lower than the excess deaths in older people, but still it means that more people are dying than we would expect. Now, this is the graphic here for the 0 to 24-year-old age range in the States, and again, rather poor that they don't differentiate it more. But this line here is 18,000. That's 18,000 there. And we can see that cumulatively the line has risen until we're around about the 17,000 mark. And it's really started rising about here, about 20. That's early 2020 when that started rising. Again, some of these will be COVID related, but of course others won't. So here we see the graphic here. You might be able to see it more clearly. So here's the numbers here for the excess deaths. That scale in thousands. Low up until, well, when did it start going up? Really, May, June, September 2020. Some of those, of course, will be COVID related. Thankfully, very few people in this age group have died from COVID, but there are some. But it carries on increasing, as we see here. Now, the projected line here, quite how they get this going down, I don't know, because it's cumulative, but we are seeing quite a high cumulative numbers of excess deaths in the 0 to 24-year-old age group in the United States, about 17,000 for the country. Now, these are statistics, of course. Now, I wouldn't normally do this, but this tragic young death is in the public domain, so I felt it was acceptable to do this as an example. It is in lots of news outlets. That's the reason I'm doing it. It's already public domain material. And of course, we give our deepest condolences to Gwen and her family. A 17-year-old died peacefully in her sleep in June. This is just awful. So sorry. After eating dinner with her parents and then going out with friends for a few hours. And the reason this is so well known in the States is Congressman's daughter, Gwen Casten, who obviously I'd never heard of, but is well known in the States. And as I say, in lots of public domain outlets. So I just kind of wanted to take it away from the statistics to the individual tragedies, of which there appears to have been 17,000. Father's party statement: she'd just come home from an evening with friends, went to bed and didn't wake up. And the Castens themselves are saying, this past June, our daughter Gwen Casten died of a sudden cardiac arrhythmia. So it looks like this same thing that that Tim died of in the UK. Tim Gough, the radio DJ who died at work yesterday. Tragic for individuals. In layman's terms, the family say she was fine and then her heart stopped. Healthy 22. 2022 teenager. So she'd been previously healthy. She was fully vaccinated against COVID. Had tested positive for COVID-19 more than once in recent months, but never experienced any symptoms. And by all accounts, a much loved daughter. Absolutely, absolutely tragic. So when we look at a graph like this, and we say numbers like cumulative deaths are well over 16,000, 17,000, we have to put that in the context of the tragedy for individual families. Now, it looks like the projection that this is levelling off. Let's hope that is correct. We can't go back, of course, because it's cumulative, but let's hope that this is the case. But we are seeing excess deaths, more than we would expect, and I think every person that has deceased should have the dignity of a formal diagnosis. And if that involves very large-scale post-mortem studies, for example, I think those resources need to be made available, because we're talking about life and death of many, many people here. These excess deaths are a real phenomena. So that's the main thing I want to say today. I'm just going to finish looking at China, which is utterly bizarre. Let's just look at it briefly here. So the Chinese have just had this big conference. President Xi Jinping basically now confirmed for life, we believe. Now, it had been hoped that this conference would be the opportunity to say, look, COVID's inevitable, we have to let it happen, as other countries have. The idea that you can stop COVID is ludicrous. It's going to be endemic for a decade or more. But the Chinese still seem to be working on this zero COVID strategy. Zero COVID, people's war to stop the spread of the virus. Apparently it's been said, I don't know if that was Xi Jinping himself or just said at the conference, but you cannot stop the virus. It is not possible. It's endemic. We are surrounded by many viral particles, and this is one of them, or viral types. Recent weeks, tens of millions have been confined home, 60 towns and cities. Dynamic zero COVID policy is linked to President Xi Jinping himself. So whether there's some sort of loss of face thing here, I don't know. But it's just bizarre that the people are suffering like this for nothing. Strict lockdowns, mass testing, constant health screening, travel restrictions. I did put this together a few days ago. Trains out of Xinjiang have been suspended. Roadblocks. Food and medical shortages. It's no secret now that some of the lockdowns have been totally disastrous. The logistics to provide people with food and other supplies, things that just haven't been done adequately. It's just terrible that the people are suffering for absolutely nothing. Quarantine centres, people taken to quarantine centres, family separations. Identity linked to health code apps, so people need health code apps to travel around. No vaccine compulsion and local vaccines only. Now, this is interesting. The Chinese vaccine, you might remember, is basically an attenuated virus or a killed virus. It's not a viral vector, and it's not a mRNA type vaccine. So why the Chinese haven't imported vaccines, and why the Chinese haven't sought to duplicate. Now, the Chinese are well capable of duplicating the adenovirus vector vaccines. That's what the Russian Sputnik V vaccine was. Basically an Oxford vaccine that they'd modified a little bit. So the Chinese well capable of making mRNA vaccines, but they've opted against that. Interesting. Don't know the reason why that is, but interesting, because they had the capacity to do it. Professor Ling Weian, government COVID expert, zero COVID might come to an end. When asked that question, he said it's hard to say. Obviously, the man's completely compromised. But one thing I'm sure of is we won't kill the virus anytime soon. Well, no, we're not going to kill the virus for the next few decades because it's going to be endemic. We're waiting for more effective medicines and more effective vaccines. Well, no sign that they're working on vaccines, and if there's a comprehensive antiviral, I will be delighted. So, political ideology, I think, in China. And I'll leave you to decide how much political ideology we have in our respective countries. Thank you for watching.